because of the smog, there's also an uptick in walking pneumonia cases. The infection, which is caused by a bacteria, damages the lining of the respiratory tract, including the throat, windpipe and the lungs. The symptoms include coughing and sneezing. They're typically milder than other lung infections, so people tend to not stay at home, stay in bed, perhaps, which is why that nickname walking pneumonia has been given. The infections are typically mild, but their symptoms last for weeks. That is what the doctors are saying. And to get more on this, we have Dr. Aditij Damija, General Physician and Health Influencer, joining us. We also have Zareen Osho, Director of the India Program Institute for Governance and Sustainable Development, joining us as well. Doctor, over to you first. When we talk about the symptoms of a walking pneumonia, there's some, usually very mild in comparison to other lung infection, but they last for weeks together. So what are the symptoms to look out for? And in case people are self-medicating, what measures should they be following?
Okay, so when you talk about atypical pneumonia, which is this walking pneumonia, firstly, we are defining this pneumonia on the basis of the symptomatic presentation rather than the organism which is causing it. We are calling it walking pneumonia because a number of young people, particularly under the age of 40, are not getting similar effects compared to, older people who might find themselves hospitalized for a long period of time or on the ventilator. So, thinking about it that way, there are a lot of people who might be spreading these kind of pneumonias, and people who are genuinely, fallible to these sort of diseases will find themselves in hospital and might even lose their lives. So what is happening right now is, because of these particulate matters which are present in the air, certain organisms which are usually, harmless are sticking to these particles and being absorbed by the, lungs, and they are causing this infection. So most people will find generally atypical symptoms. Even if they have fever, it will not be exceeding more than 101 Fahrenheit. And that is why they will be carrying on with their activities. They might be finding a bit of muscle fatigue, some weakness, but they are more likely to attribute it to other causes rather than pneumonia. And the problem lies therein where they'll be spreading this infection to other people, because just because it has, lower intensity of symptoms does not mean that there is any, lower infectivity. They are still liable to infecting other people, and these people might be bearing the brunt of the disease and might even be losing their lives. So, we should be mandating masks again, and particularly pressing on the seriousness of the issue, especially on the young people.
Right, Doctor, we also have Zareen Osho with us. Zareen, the health impact is being felt in every household according to a latest report. How effective are GRAP4 measures, or rather how long does it take for such measures to be effective?
Thank you, Divya, and very good morning to you. We have always in India decided to act on the defense. We are never preemptively ready to manage a situation. As the citizens that you just interviewed were saying, this is a problem that has come up year after year, and every year we look at GRAB being implemented, and once the air quality is under a certain measure, then the GRAB measures are taken back, as your colleague Shreya was mentioning. The problem of air pollution is that it is something to be tackled year round, year after year. So trying to preemptively do things is going to be the best way forward. Transport sector is the largest contributor to Delhi's air quality issue. And, the government is relying on PUC certificates. The problem with PUC certificates is, when were the last time instruments calibrated? Are these instruments legitimately working? These are questions that nobody is asking. And we've seen these problems happen in cities outside of India as well. We had the same problem with Jakarta in Indonesia. We had the same problem in Beijing, China. London once grappled with challenges of air pollution, so did Los Angeles. There are multiple case studies that the government of India can learn from. With China, the simple tweak was apart from making it an administrative responsibility, it was made to be a legal responsibility, air quality. And similarly in Jakarta, where transport was also one of the largest issues in the key sectors that were contributing to air pollution, PUC certificates and instrumentation was checked, and the return on investment on creating solid PUC machineries and instrument was the greatest benefit that the government in Indonesia could receive. Similarly, there needs to be a questioning of how is it that we are collecting data. And also, one thing to remember is air pollution does not look at state boundaries and state jurisdictions. It is important, and it is the only way we can control Delhi's air pollution problem if we create air sheds. Air sheds are areas that have similar weather patterns. Your rules and regulations need to be implemented over a period that is an airshed area rather than the state of Delhi or the city of New Delhi. Those are the things that will contribute to it. And then one last point that I want to really highlight is the labor productivity. We are now looking at work from home measures being taken, students being asked to stay at home and take classes online. What about the informal sector? What about the person who has to go out? Where are we accounting for labor productivity loss? This is a direct hit to Indian GDP. This is a direct hit to in the informal sector. These questions have to be asked.
Right. Of course, Ms. Osho, they're raising very pertinent questions. And, the major question being as far as penalties are concerned, the kind of implementation of these rules, because I'm hearing construction going on a few houses down from mine. And, there doesn't seem to be any kind of effective ban per se. Of course, this is all good on paper, very good to hear that there's a ban. Of course, visibly, we're seeing that there are fewer cars on the road because, of course, schools are shut, colleges are shut, as far as Delhi is concerned up until Saturday. Doctor, also take us through, when we talk about the impacts of pollution, we're also seeing an uptick as far as mental health studies are concerned in matters whether it's depression or even anxiety.
I think one of the reasons that is causing a rise of, mental health issues again due to air pollution is because we are again confining ourselves in the boundaries of our own homes, because that is what the current advisory is. Many institutes, many even workplaces have again announced work from home protocols. And that is why, when people are not able to meet other people, somehow or the other, it affects their psychology. Apart from that, air pollution can have a myriad of health effects that might, first present as some sort of a mental, lack of bandwidth, so as to say, which might, further on lead to depression. But when we talk about air pollution in these terms, we are only looking at the short-term effects, because, only people who are susceptible to these effects will be showing, some sort of damage to their cells in the short term. Here we're talking about people who already have, say, pre-existing conditions, genetic conditions, or have had instances of asthma which they've had seen exacerbations over time, which might have resulted in hospitalizations, or have had previously been affected with severe cases of pneumonia. But even people who are not susceptible to these diseases will be seeing a shortening of their lifespan if they continue to breathe this air, and if they're not taking precautions like wearing masks or restricting themselves to their homes where they can hopefully have some air purifiers. Because in the long term, not only will they be suffering from higher rates of heart attacks, higher rates of deaths due to pneumonia, but there is also a very increased risk of stroke, which is a clot going to the brain causing paralysis or even death, as well as cancer. And we are not just talking about lung cancer, we are talking about all sorts of cancers, because the kind of air that we're breathing will be causing microscopic damage to cells, and it will not be presenting itself in 1 or 2 days. It might be decades down the line. And you even have to consider that in the economic aspect, because when people are older, we are assuming they're contributing their maximum, and taking away those years from someone's life is not only tragic, but will also result in an economic impact, which is very hard to measure right now.
Right. Thank you so much, Dr. Dhamija and Ms. Osho, for joining us this morning.